as of Sunday, the governor asked all non-essential surgeries be postponed. So I had several patients that had surgery scheduled this week that we had to postpone because they weren't considered to be emergent and necessary. And so we call those kind of elective cases, and patients may be fairly bothered by a problem, but if it's not an emergency right now, the governor has asked that we not perform those so that we can save hospital beds and save protective equipment for our, doctors and nurses that need the equipment. So you don't want to use up a bunch of PPE while you're doing cases that don't need to be done, and then later find out you don't have enough. So, and it's also just to avoid exposure. So both the patients coming into a facility getting exposed to the virus, and or a healthcare provider getting exposed to the virus. So, kind of all three of those things. They decided that we should postpone elective surgeries until we were able to kind of make sure that we have a handle on things, because we don't want to get in a situation where the hospitals are over capacity.
And so, what are some of the biggest concerns, I guess, mothers have gone to you with, and answers to them, so that we could probably give some relief, some stress for some pregnant mothers who are going through some of these issues?
Yeah, so pregnancy is obviously a time where mothers are at heightened concern for both themselves and their babies. And I think right now the biggest question is, what if I get the coronavirus? How would that affect me? How would that affect my baby? People are worried. And so far, the data is still pretty limited. But when you look at the data so far, unlike some of the other viruses that pregnant women get exposed to, like the flu, we know from years and years and years of experience that when pregnant women get the flu, they tend to be in those high-risk categories. They potentially can die from the flu. And so, we're so careful about getting our pregnant women vaccinated for the flu. But so far, from the limited data that we have, pregnant women don't seem to fare any worse than other people with the coronavirus. So, the majority of the data is from China, which experienced this first, but pregnant women who were in their second or third trimesters that got sick didn't seem to do any worse than anybody else. So that's good news. And the other good news that we're trying to reassure patients about is, so far we don't have any data that suggests there is any kind of transmission from a mom who's sick to her baby. So we call that vertical transmission, and we know from like the Zika virus, when we had the Zika problems back a few years ago, that can be transmitted to the baby and can cause multiple birth defects. But so far, we don't see any of that with this virus. So that's good news. And we're going to continue to be gathering data. We don't have a whole lot of data yet for moms in their first trimester, because we've only known about this since December. So we'll be, gathering more information, probably again from China, to hopefully be able to enlighten moms who are early in their pregnancy. The other thing, it doesn't seem to increase the chances that they might need a C-section, or that they might have problems with their pregnancy. Maybe people, are worried about that as well. But so far, anyway, we've just, I haven't had a pregnant patient who's tested positive yet. So we've had a lot of people who are concerned, who have been exposed, people who've been sent home for isolation for 2 weeks. But so far, I have not had a pregnant patient test positive yet. We're trying to keep people at home as much as we can, and to limit the exposure of the people that need to come to the office from other patients. So we've basically told GYN patients who are just coming in for kind of their routine checkups and they're not having any problems, that they should postpone those for a few months. Anybody that we can do telemedicine on, we've started doing that. So a lot of our appointments, we're just talking to them over the phone. We may prescribe some medication after talking to them, but that prevents them from coming in the office. So that's helped a couple things. Number one, we don't have as much traffic in the office. We're calling every one of our patients who is scheduled for a visit in the office ahead of time to make sure that they don't have any respiratory symptoms or fever. Because if they do, we need to know about that. It's not that we wouldn't see those people, because we don't want to send everybody to the emergency room either, but we bring them in a different entrance. We have an isolation area in our office, which basically is scrubbed down after every patient. The healthcare provider who's seeing that patient will wear protective equipment that's different from what we might wear just for routine patients. So again, trying just to keep anybody who might be sick from being exposed. We have a big sign on our door that tells people, stop, don't come in here if you're sick. We have hand sanitizers everywhere. So, in the waiting area, you'll notice nobody's going to be sitting next to each other. Hand sanitizers everywhere. We're really trying to, when people are here, remind them that, they need to be socially distancing at home. And then just giving them those precautions of what to be on the lookout for and what to do, just like everybody is hearing. Wash your hands, don't touch your face,